Encouragement to turn tragedies into your own triumphant life story? If so, this podcast is for you. Listen to powerful guests who have persevered through challenges so you can gain strength to build your championship life. The host of Professor of Perseverance podcast, Dr. James Purdue.
In here, it's time for us to get started. Let's get some motivation, some inspiration. Let's get something, little golden nugget from today that can help us get through some trials and tribulations and move forward in life. Then what do? I always say we pay it forward. We help the person ahead of us and go from there. Hey, today, our guest today, man, this is going to be pretty good. You know, we're all addicted to something, right? I don't care if it's drugs, porn, working out too much, not eating enough, eating too much. Mine is eating banana splits. All right. So we all are something that we addicted to. And we got to get a hold of it somehow. And today, our guest is going to help us mainly with he works with young male gamers. Yes, all of you that are on there 14, 18 hours a day playing games and doing nothing other than that. And there's nothing wrong with that. But there's more outside that door in life. Okay? Now, young lady gamers, he may not be specifically talking to you, but I bet you take a little nuggets from here can help you as well. All right, so he works with guys to help his mission is to defeat gamer loneliness by transforming gamers into men other guys want to be and women want to be with. All right, he shows them that they can level up in life instead of video games. So welcome to the show here, the podcast, Dr. Agam Dhawan.
Perfect. Thank you, James. Thank you for having me.
Hey, thank you for being here. I'm getting a little slap on my back because I got the Agam right. So I was going Agam. All right. But yeah, thank you for being here, man.
Mm-hmm.
This is especially today, people, these young kids, all right, they let that game go forever and ever. I mean, when I first real game thing, and I'm showing my age here a little bit because I know I'm a little older than you, Agam, but the first one I remember was we had a little old black and white TV, and it was, can't remember the name of the game, but all you can do is play ping pong or something on your TV. And all they did was slide the thing up and down to hit the ball back to the other side for the other person to slide it up and down. Mm-hmm. That was our first video game that I had. You just slide the thing up and down. That was it. And then after that, we moved up to an Atari. And then we got the old Commodore 64. And then the Commodore 64 Plus. Then after that, when me being in a wheelchair after that, and my hands didn't work as well, I didn't play games much anymore. So, but that's as far as I got. Now I know they got all this great stuff where you're playing everybody around the world. You know, when I was young, the game you're playing is you and whoever's in the room with you, or you're playing against the game itself. You know, but yeah, today, I mean, I can see the great benefit playing and competing against other people. Again, there's nothing wrong with that. But again, when I eat 3 banana splits in one day, I'm over and doing it. So we got to get a hold of this little thing. All right, Agam, I don't want to take up your the whole time here, but yeah, appreciate you being here and helping these young gamers. Again, I'm including young ladies as well. I know you specialize with males, but young women, take a little bit of this gold nugget to help you as well. All right, Agam, take off, buddy. Tell us how you got started helping out with people like this.
Yeah, absolutely, James. And thank you for that introduction. So for me, I had my own journey with gaming addiction too. And that's what really kind of came full circle for it. And so when I was in high school, my routine every day was to come home around 4 o'clock, grab a plate of Oreo cookies, not just like a cookie, grab a plate or the box, the one that peels back, bring it downstairs to the basement, shut the lights off, and then just sit in front of our large screen TV that we had and game. Every day that was the routine. The
Mm-hmm.
only time I stopped was when I knew my father was coming home for dinner around 6 or 6:30 because I knew that he wouldn't like it. But then I would either go back to the game downstairs or go upstairs and play.
Okay, now hold on here for a second. Now, so you, in sense, were playing a game within the game too, right?
A game within a game.
Game within a game. You were playing your games in the basement, but you know your dad wasn't going to like it, so you're playing his game.
Yes.
Get off because you don't want to hear the griping. The get off the computer, get off the game. You don't want to get all the everybody mad at the house. And
Yep.
have a nice dinner to eat, and then once you were done playing his game, then you went back to your game.
Right.
Yeah.
Yeah, absolutely. And so I was doing this for years. And like I remember specifically sitting in class and just daydreaming about what game I was going to go play, what world I was going to be in, texting or not even texting, just like we'd made plans with friends to meet up online, right? So all of that was happening. And then I remember in my senior year, there was this girl. Her name was Priscilla. I remember this very vividly, and I wanted to ask her out to prom, but I was too scared.
Mm-hmm.
I had never been to any parties. I'd never had any social situations. I'd never really talked to many women before, and so I was scared. And then I see some other guy had asked her out, and she accepted. And so I go to prom by myself just to go, and then I see her dancing with this other guy. And in my like stomach and heart area, like I just felt this like churning sensation, like my stomach just dropped, right? And I remember that feeling of like, fuck, like I wanted to be there.
Yeah.
And every guy can relate to that because they've all had a similar feeling like that.
Oh yeah. Oh yeah.
Yeah.
Hey, now did Priscilla, was she expecting you to ask? I mean,
No,
were y'all talking in friends in school? And
we,
I mean,
we
does she even know about this now?
no, she has no
So
idea.
Priscilla may or may not be the name. Okay, just in
Yeah,
case. No, I'm
yeah,
kidding. No, I'm kidding. So yeah, this is one of the things that based on a true story. So the
uh-huh.
names have been changed to protect the innocents. No, so okay. So I was just wondering if maybe she was expecting it, and then so she had no clue that you wanted to ask.
No, of course.
Okay,
We were in
okay.
a couple classes together. We definitely like we weren't strangers. We definitely had interactions.
Yeah.
Yeah.
So yeah, so it wasn't like a shot by the dark in the night that you're saying I'm just going to go to her and ask. No, y'all are already friends
Right.
and stuff. Yeah, okay,
Right.
all right, go ahead.
Yeah. And so having that, I remember getting to college and just being like, I don't want to feel like that again. Like that felt miserable
Mm-hmm.
to go through that, right? And especially as a young guy, and this is what people don't really appreciate about like men's mental health is that we are at that age just full of testosterone. And so all we want to do is have big cars, talk to women, go to the gym, like all of these things that a lot of them kind of get pushed down, especially in today's modern society, right? Like this is what we biologically want to do. And like our hormones are pushing us to do this, right? And I remember having this realization. I was like, I got to change. Like I have to change my behavior because if I just game all the time, then I'm not going to go anywhere. Like I'm not going to be successful in like this realm of life. And then slowly started kind of getting out of my shell, getting involved socially on campus. I joined a fraternity, started like going to events and things, right? And then in the side, but then also making sure that my grades and stuff were good too. And then got to medical school, and I reflected on where I wanted to, how I could like impact like the world, what I really wanted to do, what specialty I wanted to pick. And so psychiatry really stood out to me because of the mental journey that I had made. in like the growth arc that I'd had, and then helping other people go through similar journeys too was what really spoke to me. And then, kind of got more specialized, and here we are.
I'm glad. I'm glad you woke up to realize that. And I'm sorry you had to go through that. Like you said, a churning pain and discomfort. But it was a good wake me up for that. So, but yeah. It's sad that a lot of times in our life, we have to go through some time of pain to get us to get away from whatever we're into. You know what I'm saying? It's even if it's something too good for us, and we're like I said, you can be working out all the time, and that's gonna be bad for you in the long run if you don't let your muscles rest and stuff and recover itself. That you can't just keep working out. That's why you have sleep time and rest time and alternate leg days and alternate arm days, and even something too good is too much.
Right, absolutely. And that's the function of pain, right? That's why it biologically exists, is to provide that feedback loop to adjust our behavior.
Yeah. So uh, you see, I don't know a lot about the gaming. Like I said, no, I got as far as the Commodore's 64s and things like that. And so, but I know some friends that are disabled, and I know they got all this new stuff that they can use to be able to compete and play, and you don't have to have fingers as much as you used to when you first started, and to play and everything. So, but I just hadn't got into that. So, and I mean, good or bad, it doesn't matter with me on that. So, I guess I did advance a little bit. For a while, I went to a rehab one time, and they had me playing a Wii game.
Okay.
And so I did advance up to a Wii game and brought to the house, and we're bowling here to my house, and so, but still, I didn't do any of the internet stuff that I could have done with the Wii, and
Hmm.
so it was just me and my brother or friends over, and we're bowling or tennis and the baseball games on it and stuff. So I did advance up to a Wii game, but that took me 30 years to find, to do that.
Hmm.
But all right, so now, so what would you do? What would you do if? Now I'm assuming you're working with young folks. You got mom and dad bringing the young people in,
Hmm.
okay? Because you're talking what, teenagers, preteens that you're working with.
Right. Older teenagers, young adults, like
Okay,
16 to 30s.
okay. And so, so some of them is mom and dad's bringing in. Some of them, hopefully, they're coming in on their own. Realize life
Hmm.
has got to be changed for them. And so, what's so how would you get started on trying to help them out here?
Yeah, absolutely. And so it's like you mentioned about the parents, right? Usually it's the parents who bring in their
Oh,
kids.
yeah,
Not,
and the kids, they're throwing a fit because they don't want to be there. They don't think they ought to be there, and yet, and I don't want my friends to know I'm here. And yeah, I can see that because growing up, and I remember this. I don't know if it's like that today. I hope I'm totally wrong here. Okay, growing up, we always thought if someone was seeing a psychologist or a psychiatrist, oh man, they're crazy. Man, these people crazy going to go see. And that's what was me growing up,
Mhm.
thinking that you gotta be crazy to be talking to see someone. Now, as I've gotten older, and I did attempt suicide 3 times in 3 days. That's how bad I wanted out.
Oh wow.
And the last time, of course, I lived every time, but the
Yeah.
last time I was in the hospital for 7 weeks and had to see a psychologist for a year.
Hmm.
And that's when I learned you're not necessarily crazy to go talk to someone. It's someone you can open up to, knowing they're not going to be ashamed of you. They're not going to be judgmental on you. That you can and get some advice. So yeah, and I tell people now that um, seeing a psychiatrist, psychologist is no different than working out your body. Okay, what do? You're doing all these arm exercising, you're doing these benches, doing the leg stuff and everything. But if you don't exercise your mind, whether you're talking to a psychologist, a psychiatrist, your loved one, your spouse, a great close friend, a minister, whoever, counselor, a coach, mentor. If you got to exercise your own mind to keep its strength and healthy, to get out what we call the get out the garbage and get the good stuff in.
Hmm.
So,
Yeah, absolutely. I think you're really captured on how mental health awareness and viewpoint has shifted from one generation to the next. Now, kids are wanting to seek mental health treatment, oftentimes not for gaming, but for other things like depression, anxiety. Often it's the kids who are pushing their parents to help them come in, help them get treatment.
oh, that's
And
okay. Good. Yeah, of
yeah,
course.
especially a lot with high schoolers too, right?
Good.
There's a lot more.
I'm glad that they're aware enough that something's not right and things need to change.
Mhm.
Oh, okay. Good.
Absolutely, yeah. But then, of course, the negative of that is that uh, sometimes, especially with like the newer generation, sometimes there's too much identification with labels and with diagnoses, right? So I remember I had one patient who um, the mother got upset. She was getting treated for 16-year-old girl getting treated for depression and anxiety and a lot of like mood swings as well too. And the mother came to me really upset after a session, and she says that she believes that we're making the sessions worse. And so I said, okay, like that's interesting. Like what makes you say that? And so she goes, because my friend, like the mom of another girl that the girl was in class with, had texted her because the friend had posted on, or the patient had posted on social media saying, "This is my new medication, everyone, like check it out."
Hmm.
So it's almost like she was wanting validation and wanting like internet likes, right? Because she was on medication. And so the mom was worried that she kept embellishing her symptoms and things and wanting to get a treatment, wanting to get new medications, wanting to increase doses so that way she could talk about that.
I've heard other talk shows or whatnot, uh, believing however that goes, how they go sometimes. But I can see with the generation that they are looking for the likes, you know,
Mhm.
to fulfill their self esteem, and it's sad that they come to that. It ought to be whoever your closest friends are and family and how they feel about you, not necessarily somebody on the other side of the world you've never even met and they're doing yay or nay or whatever and you're worried about them.
Yeah. If you look at the developmental phase of a teenager, right? They're in the stage where they're trying to define their own identity. They want to figure out who they are. Their peer group is the most important influence at that time. Like the parents take a sidestep.
Mm-hmm.
The peer becomes the more important, right? So peer acceptance, we're tribal creatures, is huge. And so if a kid is feeling neglected, they feel bullied, they feel like they don't belong, right? Then suddenly they get X diagnoses, let's say ADHD, and now they're getting special attention from schools, they're getting special attention from other kids, right? They get to bond with the other ADHD kids, that's their identity now,
Mm-hmm.
right? And I'm not saying that ADHD isn't real or it shouldn't be treated, right? But then we just have to be careful not to over identify with what is effectively just like symptoms and diagnoses. Like it's not an identity.
Yeah, I taught school for about 15 years, and we noticed a lot of problem. Of course, I was in seventh grade teacher, and yet these kids would definitely look to find a group to hang out with to accept them to go from there. And I understand the ADHD and HD. I understand all that something's going on, but I'm also brought up when again I'm older than you, and whenever I did something that my mom and dad didn't like, got my tail busted, and that was the medication that
Right.
I need. Where I see lack of that now, and I understand. I'm not saying beat them to a bruise or beat them to bleeding, nothing like that, but a good old get your attention smack on the bottom, not across the face,
Hmm.
nothing like it. That's very disrespectful. Nothing like that. And again, up to a certain age, you can't do a 13-year-old over your lap. You know what I'm saying? But yeah, I sure got it when I needed it, and I think that was the best medicine. Again, for me, I
Hmm.
wouldn't say it's for everybody, but it seems like there's a lot less of that today. Um, I'm not too sure about the timeouts, putting them in the corner for 3 minutes isn't, and that may work at the very beginning. So but I don't know. But yeah, you're right. Especially the preteens and teens, they're looking for that group, and we would have our teacher parent conference, and I remember telling mom and dads a few times, you need to find something that you can accept them to be involved in,
Hmm.
and you need to be involved in it with them, whether it's playing sports or checkers, or you don't like a heavy metal band, but if you don't find something that all of you can agree to and get along with, they're going to get into something you're definitely not going to like,
Yeah.
because they're looking for that validation.
Absolutely right. And I think the you mentioned that they something that they'll get into things that they don't like, right? And that's where the parents' role of curating their kids' reality becomes so important, right? Because as parents, our goal is to help the kid grow up and mature in a set of like defined boundaries, right? And then as they get older and older, we peel back the boundaries. And so, for example, right, like if a kid is involved in sports, he or she has after school activities, they have a great group of friends, they have a good family life, right? They might have a good social life. Then they don't have the need to even like deviate outside that reality that's been created for them by the parents, right? But now let's say we have a single parent, right? The single parent is working a lot. Now let's say the kid is in school. They might have to stick with after school programs. If they're socioeconomically disadvantaged, right? They might be in a worse neighborhood and might be hanging out with other kids who have uh, worse experiences or worse influences, right? Then they
Hmm.
start to get influenced by them. We know that for teens, peer influence is the most important factor, right? So the kids wants to fit in, and then it starts innocent, right? It might start with like a vape here or there, but then things escalate very quickly, right? And so there's no blame or anything being assigned here, but really just emphasizing the importance of having that set boundaries, because teens will push those boundaries, right? That's what they're designed to do. That's how they test limits. And having that reality curated for them is so important.
Oh yeah, yeah, yeah. And again, they yeah, they're just looking to way to fit in, and like you said, to feel. I remember my first year teaching, I had this one boy. He drove me nuts, and I was doing the old yelling across, "Why are you da da?" hollering his name. Everybody's listening because everybody's ignoring him because he's been yelled at. No telling how many times throughout the day, how many years in school. But it took me half a year to finally wake up and go, this yelling at this kid's only raising my heart rate and my
Hmm.
blood pressure. He doesn't care. I said, I guarantee you, he's being yelled at by mom and dad because he's already slept in late already.
Yep.
Okay. Now they're trying to get him to hurry up and eat before he misses the bus. Now he's almost missed the bus. Now the bus driver's yelling at him. And then as soon as he gets to school, he's done something where, you have to wait in the gymnasium most of the time until school starts. That whoever's watching that, but used to take most of his PE teacher, he's being yelled at them before he gets to his first period. And I started going, man, I got to do something different. He's immune to this yelling. And so I ended up taking part of my desk and cleaned it off and said, "Your desk is my desk. We're going to work together, and we're going." And so I built his trust up. Got to talking with him some, and
Hmm.
then I would let him know that I trust him. Say, "Hey, walk down to the office and ask him to make a couple of copies for me." And I said, "Now don't get down there and disappoint me." And boy, that kid changed it was great, giving them that lead way, like you said, gave them some boundaries, then opened up to let them use what's been taught to them right there, and to stay within the boundaries, but they had a little leadway that you can go get the copies, but if you stop at the bathroom or stop to get water, just don't do anything to disappoint me. So
Hmm.
yeah, yeah, I'm all with, yeah. we got to teach the young ones the boundaries. We teach them. Then after that, you got to trust when they get old enough that you've done your job, and if they goof up, we all learn together.
Hmm. Absolutely. And especially to that last point right there, right? We just earlier we talked about how pain is a teacher, right? Because it helps guide our behavior. And so that's what the function of mistakes are to learn from them and then be able to grow, right? And so often I do run into parents, especially when we're talking about, let's say, this like the gaming and stuff, right? Like if we don't let the kid make any mistakes, then, like, keep them too boxed in, don't let them push out enough, then they do become more sheltered. And I had this similar upbringing like that too, where like I wasn't allowed on sleepovers and other things because my mother was afraid that something would happen to me, right? And which was her own anxiety, but then that resulted in me retreating more inward, retreating towards this game, right?
Mm-hmm.
And so it's a similar thing where a parent, if they feel like they're almost in trying to control, not even controlling, but trying to be too protective over uh, the child, that can result in that child not being ready for the challenges of the real world.
So no wonder they're playing these games hours and hours and hours. Again, they're trying to escape reality. Again, trying to find their sense of belonging in the game world with
Hmm.
other people. So how do you go about? Do you cold turkey get off of it, or do you have mom and dad say, let them play it for 2 hours, and then tell them that's the cutoff, the boundary, you know, and don't let them go anymore, no matter how much they argue. You can increase it later. Just don't tell them 2 hours. Then you come back and say, all right, it's been 2.5 hours. You got to stick to what you say.
Hmm.
Okay. And then, so do you give them a limit to start off with backing off, or again, cold turkey?
Yeah, so that's a really good question, right? And so before we do any kind of limit or anything like that, we have to understand the function of the game, right? Like, why is the kid or the teen or the adult, like, why are they playing a game, right? There's some inner
Mm-hmm.
function that's being
Something.
satisfied,
Yes. Yes.
right? And so the problem that a lot of parents run into is like they're like, oh, gaming's bad, take away this game. Like one of my immigrant families I worked with, um, like they had a 16-year-old son, and so there were Chinese immigrants that they didn't fully understand, right? Like the video game, they just view it as bad, right? So they took it away from him. Kid became suicidal pretty shortly after, right? And so what that kid was for him was that he has a world where he goes from feeling crap in the real world to now he's like a mage or a paladin. He's level 80. He's slaying all these monsters. He's collaborating with people. He's finally part of a community. He has a Discord chat that he talks to, like real guys like him around the world, real
Mm-hmm.
people that he talks to, right? And so he has this amazing world where people like him, they respect him, they want him around, to go to reality where it's like nothing in comparison,
Yeah.
right? So the first is really understanding what the function of the game even is, right? And then second is to really make a change with somebody, right? They have to want it,
Oh,
right? The
exactly.
change can't be external. If you take the alcohol out of an alcoholic's home, he'll just go to the nearest bar. If you block that bar, if you kick him out, he'll just go to the next bar. It's until that person realizes, okay, I can't, drinking is not a good idea for me.
Until they're
That
drinking NyQuil, getting alcohol out of the cough syrup. So, yeah.
absolutely, right.
Yeah,
And
it's definitely got to be their want to change, because again, if they don't want it, they're going to play the game with them to see everybody doing yes ma'am, yes ma'am. You play the game, but then they're going to go play the game and get in trouble.
mhm,
So yeah, but they'll play the game unrealistic just so they can get out of the seeing you or whoever they're seeing, and yeah, from playing the game. But until they want that change, it's just a waste of time.
yeah, precisely. You just reminded me of something. I used to game during the lunch period too of
Oh,
school. yeah, we had a computer lab, and so me and two other friends that I had, every lunch we would go to this computer lab, and there was like either one teacher there or no one there, and we would game. We had these like USB discs, and so we all had Halo pre-installed on the game or on the USB, so that way
Mhm.
you go to school and you pop it in, and it's right there, and you can play. So
You just remind me of something my mom told me when she went to high school, and I'm thinking, boy, times have changed. Like, yeah, it's you're, playing, sneaking and playing the game because you're still that addicted, and then going to get that play. But she said that when she was in high school, there'd be a couple of boys that would go straight to the science labs, and they had hooked up a small moonshine still, and the teacher didn't know what they were doing, and they come
mhm.
in, and they said at lunchtime they'd go in and everybody get a little sip of it. They said they didn't get drunk off of it, just enough to get a good sip. Everybody had
Yeah.
about 4 or 5 of them. I'm thinking, wow, my mom went from drinking moonshine to y'all today playing games at lunch.
Hmm.
So
And
times
if
have changed.
and if you really want to hear it now for today's generation, right? Like vaping is a thing. So when their kids are at home, right? Like they it's hard to get away with vaping, right? But then if they're at school, it's a lot easier. You can vape in the bathrooms. If you don't have it, the kid next door might have it, and he'll bring his vape that he got from his older brother. And so, then you can really have access to it there too, right? But it's all circling back to our point that taking away that stimulus forcibly never solves the issue, right? It's really getting to that internal change of having that person appreciate that it's a problem and realize the impact it's causing on them, and then them having that spontaneous desire created in them to want to shift their behavior.
Yeah, a friend of mine, we've been friends for over 40 years, 45 years now, and he has been in and out of trouble in prison, jail, in and out over 20 years, in and out, in and out. And one time he's locked up and they told him he's going to have to go through AA, see counseling, whatever else. And he said the first day he goes to them, he says, I've already been through this. I've done, and until I want to really do this and learn and quit, there's nothing you can tell me is going to stop me. And the counselor said, no, you're right. You don't have to come back to me until you're ready.
Mm-hmm.
And yeah, but that's what we were talking about. Until they are ready for the change, it's just a waste of their time. And you can give them the knowledge, you can give them the information, you can
Mm-hmm.
show them and everything. But again, hopefully in the long run, they'll use it. But until they're ready to use it, nothing going to do with it.
Yep. And so that goes back to the thing we're talking about again, right? Is that pain is a teacher. And so by, like in my scenario, right, by feeling that pain of that pitfall in my stomach, right, seeing her dance, that was like I guess like the trigger for me, right? And everyone else has their own thing. Like I'll tell you a story about not a gaming patient, but another older patient I worked with. So this was a 50, mid 60-year-old gentleman, right? And he'd had multiple heart attacks. And so I was on my medicine rotation in medical school, and so he just had like a third heart attack. And so we're talking to him. He's obviously, he knows all this stuff because he's a smoker. So he smokes like 2-3 packs a day. And so obviously he knows that it's bad for him. The cardiologist has told him numerous times, right? Probably told him the next heart attack's going to kill him,
Mm-hmm.
right? Like doesn't really, and obviously still continues that behavior. And I remember chatting with him, and we were talking about like kind of his life a little bit, right? And so he tells me that his granddaughter got engaged, and he was so happy for her, right? And I'm like, okay, that's great. Like, are you going to the wedding, right? And he's like, well, the wedding's in like 4 months or 6 months or whatever. Are you going to be able to make that? And then he like really stopped and started thinking, and he was like, I don't know if I can make, like with these heart attacks, I don't know if I'm going to make it to my daughter's or my granddaughter's wedding.
Mm-hmm.
And like I could see that drop on his face, and he just like, oh fuck, like I might
He
not make it to my granddaughter's wedding.
he hadn't thought about it up to this point.
And so then he may have logically perceived it, but like not the emotional core, right?
Hmm, hmm.
And so think about it from his perspective, right? He raised a child, and that child had a grandchild, which is like the greatest, most fulfilling thing that you can do as a parent is to see your kid be successful and then pass on their legacy. And now he's going to miss that moment because of the choices that he made. Quit the next day.
All right, awesome.
Quit the next day, literally.
So, I mean, that's awesome, and I got to eventually got to the wedding and saw it.
Yeah, so I never saw him after that. So I saw him like in the clinic when he followed up, right? And then I left a rotation afterward. But I like to believe that he did because
Yeah,
when
yeah,
I
yeah.
followed up with him the next time I saw him in clinic, like 2 or 3 weeks later, he said, "Yeah, I still haven't gone back to smoking."
Good deal. My mom, she went through a situation and started having congestive heart failure, and she was smoking 2 packs a day. And doctors put her in the ICU. Well, at first, had her in the hospital, and she was laboring, breathing, couldn't get enough oxygen in and carbon dioxide out. And
Hmm.
so he wanted to put her in the ICU. And she says, "Oh, I can't stay here. I got to go home," because her mother with Alzheimer's had moved into her house with her, and she was going, "I got all of my boys and my mom to take care of." The doctor told her, said, "Well, I can't stop you from leaving, and if you want to go home and die, I can't stop you." And then after he said that to her, she went to ICU and she quit cold turkey smoking. For her, and here it is, 25 years later, she's still hanging around with me. She's 83.
Yeah.
So, yeah, she quit at that too. So, you can a lot of things you can do with that willpower, the mind, and everything. And it's a struggle. She says every day she thinks about smoking one, but she's
Hmm.
afraid she'll get addicted back to it. That's why she doesn't do it. But yeah, it's amazing when we really want to change, make a change, we can. Now, not to say again, if she would have slipped up and smoked one, wouldn't have been the worst thing if it had been just that one. Um, but you don't know that. So sometimes we do goof up, and what's those saying, fell off the wagon, and
Hmm.
so we just get back and try it again. So go from there.
Yeah, that's actually a huge part of addiction um, psychiatry as well too. Is that relapse is part of the process, and what's happening every time you relapse, right? The consequences get a little bigger, and then the pain gets a little bit bigger too, right? And so it's as that starts to build up, right? Like consequences get worse and worse, the pain starts building and building. It's like when do you reach that threshold where there you've had enough pain to where that motivates the behavior change?
Is the pain on this part? This is what I just thought of. On this part, is it because you're feeling so guilty that you keep falling off?
Yeah, I mean that's part of it
You're
too.
going, you're going, you're going. Damn, I done fell off again. I'm disappointed everybody else around me, and then
Hmm.
you do it again. 3 months later, you go, man. You know what I'm saying?
Hmm. It's that too. Of course, the emotional pain, the guilt that you feel, but also the consequences in real life. Take an alcoholic, right? For example, first time, he might lose his wife might say, "Yeah, I'm going to divorce you if you start drinking again." He starts drinking again. She doesn't divorce him. He starts drinking again. She doesn't divorce him. He starts drinking again, and she divorces him and takes the kids. Now that pain is much greater than what he experienced
Yeah.
previously. The consequences are a lot more severe now. And so now that might motivate him to quit because now there's been enough pain that he's reached a greater threshold for himself that
Hmm.
he had not before.
Yeah. Well, this has been enlightening. I appreciate you coming here, helping out the young males again, whether it's teenagers up to your 30s, helping them again. Ladies, you still something you can learn from this as well to use in life. So, hey, go ahead and give us. We're going to need to move on, but I appreciate it. We may even do a part two one day with you to get some more ideas here. So, We appreciate you being here. If you can go ahead and give us a social media and website and stuff, how people can find you.
Yeah, absolutely. And thank you, James, again for having me on. So, if you or someone you know is struggling with depression, anxiety, ADHD, or gaming addiction, you feel like that they would be a good fit to work with me, then feel free to book a consult on my website, www.agamdawanmd.com. And yeah, I'd be happy to have a consult with you and see if we're a good fit and yeah, see if how we can help.
All right, good. And you see people with Zoom wise nowadays with the way it is, or it's at face to
That's
face.
correct. Yeah. So I'm licensed in a couple states and expanding that too. But yeah, we do all of our sessions electronically.
Okay, good. Well, that's a lot easier than everybody else too. So, all right,
Absolutely.
Agam. Hey, appreciate you being here, Agam, and thank you again for your insights and professionalism. So, anybody else, if you need to check Dr. Dhawan out, to be sure to do that. And I put the website down in the show notes to make it easier for people to find you and everything. So, hey, we know there's people hurting and struggling today. If you can leave us with one positive nugget to help us get through today, that'd be awesome.
Yeah, absolutely, James. Thank you. So the one thing I want to stress with everyone is that just like in a video game, right? We spend our time leveling up our stats. We buff up our attack. We grind to get our defense up. We try to increase our speed, right? We fight all these monsters to gain these stats. We can do the same thing in real life. We can buff up our social skill stats, our fitness stats, our um, intellectual stats, right? Our career stats, all of these things. We can apply that same mentality in video gaming, that constant achievement to real life, and then actually level up our real life, fight the real life bosses, and then be able to get those real life results and the rewards, the loot that we've always wanted.
All right. Yes, awesome. So when you're gaming early, it's not a waste of time overall. You can still use what you've learned during that to use in life to be successful. So,
Absolutely.
all right. Hey, thank you, man. Everybody else, hey, be sure to check this out. Share it with someone you know can use some information here. I'm Dr. James Perdue, Professor of Perseverance. Thank you for listening to Professor of Perseverance podcast. Do something today, tomorrow, something next week that's going to help you persevere past your paralysis.